Hello, everybody. I'm really sorry about the technical glitch. We were supposed to go live on Zoom too, and there was some problem to, stream from Zoom to Facebook Live. Anyway, let's come back to the topic. I'm Dr. Damodar Rao, fertility and reproductive surgery consultant at Rao Hospital, Coimbatore. Today, we're going to be talking about male infertility, something that's not really discussed very much in the open. Actually, getting into infertility, statistics about infertility, if you look at it, it's 40% female factor, 40% male factor, and 20% unknown. So if you look at it, 40% of infertility is probably because of male factors. It could be hormonal, it could be diabetes, it could be medicines that he's taking, maybe, for example, because of hypertension. It could be certain conditions such as varicocele, certain anatomical structures, or it could even be a genetic factor itself. So what I'll be doing is already I've gotten a few questions by mail, and I'll be taking those questions first, and I'll be waiting for the questions to come in from the viewers too. I'm going to be keeping your names anonymous so that you feel comfortable in asking the questions. Okay, so the first question is, how do you do a test for male infertility? So in test for male infertility, what is basically done is you have to give your semen into a container that is given by the lab, usually after about 2 to 4 days of abstinence. And usually about 2 to 4 days of abstinence, and you have to give it to the lab within half an hour. Okay, and the results are also got within about 2 to 3 hours. So this is how the male infertility test is got. What is the normal sperm count? The normal sperm count is anywhere between 15 million to 40% per ml, and 40% motility and 4% of normal forms. Now, what does this mean actually? Anywhere between, when you look at 1 ml of sperm, there should be at least 15 to 40 million. If you're below 15, then you're said to have a low sperm count. 40% motility is when you look at 100 sperms, you should at least have 40 motile sperms. And when you look at the normal forms, basically when you say normal forms, each sperm has a head, a body, and a tail. And we are able to, looking under the microscope, we're actually able to identify which of the sperms are normal and abnormal. You could have head defects, you could have body defects, you could have tail defects in the sperm. So at least out of 100, you should at least have 4 to 5 normal sperms. The next question is, this is commonly asked, is it true that keeping mobiles in your pocket or a laptop on your lap can affect fertility? Well, a lot of research has gone into this, and yes, laptops for sure, because there's a lot of heat generated by the laptops, because majority of the laptops have a very strong battery, and these generate a lot of heat. And then when you place them on your lap, it's not really good for sperm production. The testicles themselves are actually outside the body. It's not like within your abdomen or something like that. It's placed outside your body so that it's at a cooler temperature than rest of your body, and that is suitable for sperm production. So your laptop, which is going to be producing a lot of heat when you place it on your lap, is not good for sperm production, and there is enough evidence for it. Mobile phones, again, there's a long debate about it going on. Yes, mobile phones too, they're worried about the electromagnetic radiations from them. We're worried about even signals from the Wi-Fi and Bluetooth and things like that. So it is best to keep your mobile phone away from your pocket, keep it on the table when at work, or if you're infertile, at least keep it in your shirt pocket. And laptops, definitely don't keep it on your lap, keep it on the table, or keep a pillow or something and then place it on your lap and then use the laptop. I have a couple of questions coming in. Again, wearing skinny jeans or tight clothing, is it not good for fertility? Thank you for that question. Yes. Again, this is very similar to what I just answered. That is basically if you're wearing tight jeans or tight fitting clothes, again the heat in your groin area is going to increase, which is again not good for sperm production. So no, tight clothing is usually not good. Even like a hot bath like a sauna is not good. Same goes for your laptops and mobile phones. Testing for male fertility, again, I just spoke about it. I already mentioned it. Basically, you have to give your sperm into a container given by the lab. It's in about 2 to 4 days abstinence, and then the sperm they will give you the results in about 2 to 3 days. And I've also discussed the sperm parameters over there. There is slowness and buffering. I hope this is improved now. Are there any supplements you recommend to boost your count, motility, or morphology? This has become very big nowadays, talking about supplements for boosting your male fertility. Basically, what do these supplements do? They basically give you a lot of antioxidants. These are actually like multivitamins for your sperms. Vitamin A, vitamin C, vitamin E, selenium, zinc. These are all considered great antioxidants. I would just basically say, eat a very healthy diet. A lot of green leafy vegetables, they contain a lot of antioxidants. A lot of fruits also contain a lot of antioxidants. So please do have a healthy diet, and that's the most important thing. Supplements, yes. If you think that through your diet you're not getting enough, you can take any multivitamin. There are a number of brands out there which are for male fertility itself, and you can take these. And don't think that if you just take these for a week or 10 days, it's going to improve your fertility. The life of a sperm itself is about 60 days. That is from, being a baby sperm to a mature sperm is about 50 days. So you should take the supplements at least for 2 months to see any change. And it's not that when you take supplements, you're always going to see 100% improvement. You will see an improvement if only the damage to your sperm is due to, damage due to free radicals, and only then the antioxidants will help you. But if it's due to some other cause, then they may not help you. Just looking at the next question. How does smoking, caffeine, and alcohol affect fertility? Yes, that's a good question too. Now, this uh, number of studies have been done. There's nothing about the number of cigarettes you smoke or the amount of alcohol you consume. Alcohol, definitely, they say if you have more than two drinks per day, it's not good for your for the health of your sperm. Smoking, definitely, they produce a lot of free radicals, and they can cause damage to your sperm. Um, Coffee, again, uh, there's always a lot of study going on. They'll say this year caffeine is good, next year caffeine is bad. So if you're going to have that 1 cup of coffee every day or 2 cups of coffee every day, please go ahead. Don't refrain from having coffee. What is most important is that you have a healthy, balanced diet. You do moderate amount of exercise, and cut down your smoking and drinking as much as possible. Um, how does COVID-19 affect male fertility? So basically, there are a few studies coming up. There is no solid evidence that the virus can really affect your sperm count or motility. But if any infection, forget COVID, any infection, any small fever that you have, the week that you have fever, yes, definitely it can affect your sperm count and motility. So don't really worry about COVID-19, guys. It's not, nothing's really proven as yet. These are a couple of questions that have come through mail. What are some of the challenges related to male fertility that can affect my ability to have children? Yeah, so I've already discussed all of this in the last 10 minutes. So basically, lifestyle, okay, um, uh, is very, very important. Please see that you're active and you have a healthy lifestyle. Everything in moderation is all right. So, your diet, a good balanced diet, a lot of green leafy vegetables and fruits. Exercise, moderate amount of exercise is good, but they say heavy exercise is not really good. It could be counterproductive. Um, so these are the main things. Again, age. As age advances, um, if you say people who are in their 50s, men who are 50s and 60s, they say that there can be a decrease in the sperm count and quality. So the next question is, does a man's age affect the quality and quantity of sperm? I was just discussing this. Yes, that's a good question. Um, the man's age can affect fertility or the sperm quality only after his 50s, when he's into his 50s and 60s. That's what literature says now, and that's the evidence that is there right now. As he ages, when he reaches his 50s and 60s, they say that the sperm quality goes down, and maybe the children can have some genetic abnormality in them or some morphological defect in them. But again, these incidences are very, very rare. Maybe if the rates were 1 in 1,000 for younger men, it would be 2 in 1,000 for older men. So it's not like a big number at all. We are currently undergoing treatment with male infertility, and a doctor has advised us ICSI. My husband's sperm count is under 1 million. Is there any chance we could go for IUI option, which is supposed to be less expensive? Thank you for this question. Yeah, so the main thing over here we're discussing is IUI versus ICSI. If your husband's count is anything less than 5 million, we definitely say that an ICSI is advised. A count more than 10 million, definitely you can do an IUI. 5 to 10 is again a gray area, but less than 5 million, we would definitely advise an IVF or ICSI, which will definitely have a higher chance of pregnancy. Yes, IUI may be cheaper, and but if you look at it, the success rate of IUI is about 15 to 20%, and the success rate of an IVF is about 50 to 60%. And given your husband's count, which is less than 1 million, you're not really going to see a good success with the IUI at all. My wife and I want to see an infertility specialist. Doctor is advised to do artificial insemination because of my sperm. What do they do in this procedure? Please explain. So, yeah, we'd already discussed about IUI and IVF. IUI, what they do basically is your husband will have to give his semen sample on the day of your ovulation. They will start the cycle with giving you probably tablets or injections so that there is a good growth of your egg. The aim is to get 1 or 2 mature eggs from the woman's side. And once they see that the egg is released into the woman's body by scan, what they do is they will be your husband will ask to give his semen sample for to the lab for semen preparation, and then there is a way to prepare the sperm for IUI, and they take the best motile sperms and then they load it into a small catheter, and that is finally injected into your uterus. It's an absolutely painless procedure. It hardly takes about 5 minutes. It's a very simple procedure, and success rates of an IUI are anywhere between 15 to 20%. So the next question is, my husband and I have one child, and we're now struggling with secondary infertility. His testosterone was slightly low and sperm count was about 12,000. What do they mean by secondary infertility? What causes it? And are there any chances of us conceiving naturally again? So, yeah, thank you for this question. Um, The main concern here, we're talking about a couple of things. What is secondary infertility? Secondary infertility basically means that you already conceived once or twice, or you already conceived before, and now you're unable to conceive this time. And there are a number of causes for secondary infertility on the male. Basically, it's to do with age on and ovarian reserve on the woman's side, and there could be various other factors. On the man's side, if you look at it, um, the most common factor is something called a varicocele. Varicocele is basically when the veins in the testis uh, swell up, and this could increase the temperature of the testis. It is very similar to varicose veins that you have in your legs. So, if you look at the varicocele, what it basically does is it increases the temperature around your testis, which is not good for sperm production, and hence the sperm production can come down. There could be various other factors. Is he diabetic? Is he hypertensive? Is he on chronic medications? You could also do a couple of hormones to see if his thyroid is in place, if his prolactin levels are in place. So you could do a couple of tests to, rule out all these problems for secondary infertility. Once you have, found out a cause, if there are any of these causes, they are treatable. Yes, you can improve your husband's sperm count. A lot of men also tend to put on weight. Obesity itself can be one of the causes. As age advances, a lot of men tend to put on weight. If he's put on a lot of weight of recent, definitely losing weight can really help him. But if the count is really 12,000 and no factors are identified, no correctable factors are other identified, what you will have to do with the count of 12,000 is definitely you will have to go in for an ICSI. What is ICSI? ICSI is basically intracytoplasmic single sperm injection. That is, back in the day, we used to do something called an IVF, that is in vitro fertilization. That is when fertilization occurs outside the body. Back in the day, what was done is the eggs would be taken from the woman, the sperms are taken, and then they're placed in a petri dish, and the sperms had to go in to the egg into the eggs on their own. But in case the sperms had low motility or the quality is not too good, they wouldn't be able to penetrate the egg on their own. So ICSI is a boon for men now with very low motility, especially. What is done is the embryologists themselves in the lab take the sperm and push the sperm into the egg under the microscope, and you're able to get good success rates with ICSI. I'm currently using supplements to improve sperm. How long should I wait to see if there is any improvement? Thank you for this question. We had discussed this question a couple of minutes back. I guess you weren't there around. Um, so what was done is basically, if you're taking the main thing is a balanced diet, a healthy lifestyle, and moderate amount of exercise. Okay, anything in moderation is all right. But right now, if you are trying to become get pregnant, and if you're smoking too much, or if you are drinking more than 2 drinks a day, definitely cut down. If you're able to go off alcohol and smoking, that's great. And supplements, definitely they do help you. If you think you're not getting enough of multivitamins in your food through supplements, then you can take supplements, but you have to keep in mind that you have to take this for at least 2 to 3 months. Okay, only then will you see some kind of improvement in your sperm count. And again, supplements does not mean that you will always have an improvement in your sperm count. Rule out other factors. Look at, are you obese? Do you have diabetes? Check your hormones. Are you taking any chronic medication for your hypertension or any other medicines on a long-term basis? So rule out all these factors, and once all that is ruled out, yes, you can definitely try supplements. Um, the next question is, we've been trying to conceive for 6 months. My husband is overweight with type 2 diabetes. He's never had any test done, but I'm worried that his medical issues are interfering with our ability to get pregnant. Please advise. Uh, so yes, obese. You said your husband is overweight. Obesity itself can be a factor for low sperm count. So definitely has to try and lose weight. The obesity itself could be a factor for his diabetes. Diabetes and sperm count definitely do have a direct correlation. If you treat the diabetes, there is a high chance that his sperm production can come back to normal. I've seen a lot of obese diabetic men who lose weight and uh, they also control the diabetes with the help of medication for a bit. And I've seen their sperm counts improve from very, very low counts, as from as low as 50,000 or 1 million. I've seen it to even come to about 7, 8, or even 10 million. So it can make a big, big change. So definitely he has to get himself checked, get his hormones checked, see that his weight is under control, his diabetes is under control, and I'm sure you're going to have a successful pregnancy. Will abstaining from sex help my sperm count rise back? Well, this is probably a myth. In fact, the best sperms are in fact produced when you have an abstinence period of 24 to 48 hours. Because the longer the sperms are there in your testis, they say that there is more free radical damage to your sperms. So yes, definitely, uh, abstaining from sex will not help your sperm count, uh, and the best sperm is produced when there is a gap of 24 to 48 hours. So that's a myth. This is another question saying, what is the reason for nil sperm count, even though there is no genetic problem, thyroid problem, like many tests we have done? And finally, even my husband did varicose surgery, but even still here, there is no improvement. May I know the reason, please? So I guess you've already done your karyotyping and you've done your hormones already, and you've also done a varicose surgery. Well, you have to again look at certain things. Is he obese? Has he been an obese child from childhood? Has he had obesity? Um, Nowadays, a lot of things that are involved. The kind of lifestyle we lead. Um, it could be, even though we think that the water we drink and the air we breathe is good, it really isn't. There's so much of pollution out there. Our water table is completely polluted. There's a lot of toxins running in the water table, and our water is also not healthy. So do try and make some lifestyle changes if you can. There are some individuals who are by birth born with nil sperm count. But if you're, have a nil sperm count, the best thing, and if he has no other reason, the best thing would be to do a sperm retrieval, do a testicular biopsy or a testicular sperm extraction. And if his hormone levels are normal, there is a high chance that he's going to retrieve sperms through a, testicular extraction or a testicular biopsy, and then you can use these sperms and then do an IVF. Vasectomy versus sperm retrieval. Uh, how does one become pregnant after that? So, okay, there are a couple of questions. Okay, I'm just continuing to answer this particular question. So, again, there's no obesity problem, no other problems, healthy lifestyle. Yes, sadly, some people can have no. This is a great question, and this problem is seen in many people. It can be just by birth. Okay, can have no sperm production, and in such men, discuss with your doctor about sperm retrieval, testicular biopsy. Okay, and maybe through that, if you get some sperms, you can definitely have an IVF through that sperm. And the worst case scenario, if you're not able to retrieve sperms from his own testes, then you might have to go for a donor sperm program. Coming back to the old question, vasectomy versus sperm retrieval. Uh, Vasectomy is basically when the like how the tubes are tied for women. The vas deferens is also tied in men, and then there is no, it's basically male sterilization. Vasectomy, yes, it can be reversed, and it 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 can be reversed, and it will take about 6 to 8 weeks for your sperm production to come back to normal. Versus sperm retrieval. Sperm retrieval is what I was talking about previously. That is testicular biopsy or a testicular extraction, where you take a small piece of tissue from the testis and then you study under the microscope if there are sperms or not. And if there are sperms, these sperms can be frozen and then you can use them for an IVF. So, what would be the difference is if you're doing a vasectomy reversal, you can try and you can try to and achieve a pregnancy naturally, the natural way. But if you do a sperm retrieval, then you will have to conceive only through IVF. Either way, the man will have to undergo a procedure. Okay, there are, I think, a couple of questions that I've missed. Let me just have a look. Skinny jeans, I've answered them. Male fertility, I've done. Morphology, I've done. COVID-19, I've spoken about. Laptops, I've spoken about. Smoking, drinking, and caffeine, I've spoken about. Um, how do you overcome early ejaculation? Well, there are medicines for early ejaculation which you can take, and there are also a couple of exercises which can be taught to overcome early ejaculation. You can DM me and you can get in touch with you, and then we can tell you exactly how to overcome early ejaculation. Thank you for that question. So I think we are uh, done with most of the questions for today. And if there are any more questions, we'll take it up. You can always mail us or reach out to us through our Facebook page or through our Rao Hospital website. And yes, thank you for these questions. I hope I've answered most of your questions and they've all been sorted. Sorry for the technical glitch that we had initially. And yeah, I think we should be back in another 2 weeks. So keep your questions ready, and we'll be there to answer all of them. Thank you.